Hello everyone, today I'm going to be talking about sheep vaccines. These are the vaccines that some sheep are required to have in order for them to be slaughtered in the end, so we can make sure that all humans' consumption or anything else is safe for us that we can eat so we don't get either diseases or infections. This is made by me, Brandon Delgado. There are going to be some common sheep clostridial diseases. Many diseases affect sheep. Some include tetanus, black leg, malignant edema, and black disease. These are just a couple of common ones that should always be taken care of early to not cause any severe problems in the future. Tetanus. This disease is widespread in sheep and caused by a bacteria called Clostridium tetani. The effects of this will cause the sheep to have muscle stiffness and spasms, bloat, and uncoordinated walking. The reason why sheep get this disease in the first place is that the Clostridium is in the soil and manure. Therefore, the way to prevent it from spreading to more sheep is by vaccinating them with enterotoxemia. Vaccinating should be done when sheep are about 6 to 8 weeks old, and a booster should be added 4 weeks later to give them the best immunity against the disease. Blackleg. It's caused by soil-borne bacteria Clostridium chavet. This disease has multiple effects on animals and even deaths. Usually, they occur between the owner noticing this sickness. Therefore, vaccination is the only means of protecting this from the animals against blackleg. Tetanus and anti-serum are the two leading vaccines that can be used when treating this type of disease. Malignant edema. This infection is caused by contamination through wounds. Some of the viral organisms are responsible are C. septicum, C. chavoi, C. perfringens, C. novoi, and C. sordeli. They're commonly found in soil and are contaminated after castration, shearing, tail docking, and fight wounds in rams. The symptoms of this disease are swelling and inflammation due to the buildup of gas. The skin will turn into a dark color. So this disease has to be caught early in this stage. So there is no problems throughout the future. Calves should be vaccinated at 2 months of age and should also be vaccinated annually. Black disease. Black disease is caused by Clostridium novi. It is fatal to sheep if not taken care of at its early stage. Usually it's associated with the liver or fluke infestation. The organism produces toxins into the liver, damaging it. The spores can survive in the soil and pasture for many years. If a sheep ingests it, they will have problems with this due to the spores. So to control this is by administering toxoid. If sheep get infected, give them a shield of protection from the spores. This is what usually is the best medicine to give them. So to have a type of immunity or shield against the spores. Scours. Scours is a diarrhea disease of the digestive system in calves. This affects the will cause of water to lose in their body. Electrolytes are important in the body for them so they can maintain a proper body function so they don't feel dizzy, anything like that. The impact of losing, like I said, will cause metabolic acidosis, which can kill a calf or sheep if not treated. The treatment to use if this ever occurs is to give some antibiotics with symptomatic medicines. I provided right here some examples that farmers or any owners they can use. Pneumonia. This infection is due to stressors and infections. These are the main two that break down the mucosal barrier from the lower respiratory tract. The symptoms include cough, fever, nasal discharge, depression, and sudden death. The intelligent choice to make in this situation is to administer antibiotics that will stop the bacteria from growing or replicating. Chlamydiosis. This is an abortion for sheep. It can occur during a pregnancy, and it can happen at any stage of the pregnancy. Some symptoms include failure of reproduction, and some ways to treat this disease is through oral or injecting antibiotics. There isn't precisely a type of vaccine that people can use to like stop this. This is just sometimes naturally happens, but the chlamydia vaccine for sheep is somewhat effective. These are my references right here that I use for some of the information that I used in this PowerPoint. But